Hello, I'm Dr. Wanda Torres, MD. I am the founder of Suncoast Women's Care, a medical facility renowned for our expertise in women's reproductive health, obstetrics, minimally invasive surgery, and robotic-assisted surgery. Join me each week as I interview guests in the top of their fields about the world of OBGYN, exploring the innovations and personal stories that shape our medical experiences. Hello, everyone. Here we are again with our podcast series, Conversations with Your Midwife. I'm Dr. Wanda Torres, and I'm here to present our wonderful nurse midwife, Robin Reese. She has several years of experience, at least 20, and she has delivered many babies in the Tampa Bay area. Welcome, Robin, to our podcast series.
Thanks, Dr. Torres.
And today we are going to be talking about preconceptional counseling.
Perfect.
So, what is it, and what do we need to counsel our patients about?
Okay, well, our goal is on every visit when you come for your OBGYN wellness visit is to decide whether we need to go for contraception because we're trying to prevent pregnancy. If not, my patients know I'm like, ready to go. When are we going to have a baby? And we talk about how we can get our body ready for pregnancy.
So in these visits, what kind of questions you like to ask the patients? What do they need to be aware of? Do they need to bring you a medication list? What are you going to talk about?
Okay. Because half of the pregnancies in the United States are unplanned, we want to make them planned and intended instead of unintended. So we start trying to optimize your medical care. We start looking at your chronic health issues. If you are hypertensive, is your blood pressure under control? Are your medications safe with pregnancy? If you are diabetic, is your sugars under control? Do you have an endocrinologist? Or do we need to start working on referral physicians for you? If you are asthmatic, is your asthma under control? If you're under care for any psychiatric illnesses, do you see a therapist? Are you on medications that are safe with pregnancy, or do we need to change them? We'll assess nutrition status. If you're obese, we talk about our diet and what our risk factors are. Some patients who have recently had surgery might have had a gastric sleeve surgery. We want to try to encourage pregnancy to be held off for at least 1 to 2 years because we worry about how much your body will absorb and what your vitamin intake will be. If you have any other autoimmune issues, we come up with a plan so we can coordinate with whether it's your rheumatologist or gastroenterologist, a plan of care if we can continue your medication.
Well, because ultimately the goal with a preconceptional counseling and prior to pregnancy the ultimate goal is just to have a healthy mom and a healthy baby, right?
Absolutely.
So we are going to optimize the patient's health prior to conceiving. So what nutritional advice would you tell the patient that's trying to conceive what she should be avoiding or what she should be doing to optimize her pregnancy?
Ideally starting prenatal vitamins at least 1 month before conception, making sure they have folic acid in them, a minimum of 400 micrograms. We also like you to have the omega fatty acids, 300 milligrams. We talk about avoiding fish high in mercury, and we provide all that literature for you in the office. We have preconceptual lists. You don't have to go out and memorize it. We also work on avoiding foods that are not pasteurized, your cheeses, meats that are not cooked. Dietitians are always available because if you start out overweight, you're at more risk for diabetes during pregnancy or blood pressure or the risk of a cesarean section because babies get too big. If you're underweight, you're at risk for underdevelopment of babies. So we ultimately try to address it on your first visit.
Are there any important vaccines that we need to talk about to our patients prior to conceiving?
Absolutely. Every year, everyone should get their flu shot, and you can get that. It's very safe in pregnancy, a COVID booster if you're due. If you haven't had the hepatitis series, you can do that even during pregnancy. We would do blood work on a preconceptual visit to make sure you've maintained immunity to rubella. If you have to take that vaccine, we recommend that you wait 28 days from the time of the vaccine before you get pregnant. We also recommend to see if you've had the chickenpox in the past, we can offer you that vaccine. Again, waiting 28 days before getting pregnant. Those are primary vaccines that we do recommend
Okay.
for you.
And as far as when the patient, finds out, oh my God, I have a positive pregnancy test, when do these patients need to come to our office? How quick they need to make the appointment?
Feel free to call with a positive pregnancy test, but we usually like to see you around 8 weeks. So at that visit, we can go through all your health history, update your pap smear if it's needed, review any concerns that you have, and then set up your first ultrasound. We like to do an ultrasound somewhere between 8 and 10 weeks and talk about different genetic testing also, if we haven't already done that preconceptually.
Okay, perfect. So what is the genetic testing that you would offer the patient at that initial visit?
So at the initial visit, we talk about family history, if there was any Ashkenazi Jewish background, any French Canadian or Cajun background. There's different neurological testing that we would offer. We encourage everyone to get screened for cystic fibrosis. We also offer testing for the hereditary iron issues or thalassemia. It used to be offered to just people of Mediterranean descent or Hispanic descent, but now the College of OBGYN recommends that we offer everyone that testing. And then if there was any genetic disorders in your family, we can do that along with genetic counseling.
Perfect. So we definitely are looking forward to our patients coming and for preconceptional counseling. And we have Robin and our whole team that will be happy to see everyone at our office. So, Robin, after so many years in practice, do you have an idea how many babies you have delivered?
So about 6 years ago, I stopped counting at 2,500. So
Okay.
it's probably close to 3,000 at this point.
Okay, so that's quite a bit of babies. So being a midwife, do you have any recommendations as far as delivering at home versus delivering at the hospital?
Definitely deliver at the hospital. There's times when things can be unplanned and unpredicted, and it's nice to have that safety net. We have wonderful nurses at Mease Countryside where we deliver. They will allow you to walk around, be on portable monitors, labor in the shower, and do different things that you could normally do at home, but with the safety knowing that if any complications occur, we're right there in the hospital.
And we were talking about preconceptional counseling, but sometimes our patients surprise us. And after delivering, they come back pregnant immediately. So, what is the recommendation of the interpregnancy interval?
Recommendation is a minimum of 6 months. However, if you had a C-section or complications with the pregnancy, they do recommend waiting at least 18 months. You can come visit us at any point, for visits or just pop in. We love that, but we definitely like you guys to be at the optimal time before trying to conceive a second time.
And any good stories that you have for us, Robin, with all of those 2,500 deliveries?
Uh, the,
Anything that comes to mind?
the nurses know I tell all my patients to go to the Spinning Babies website. They will forever walk in seeing me with a patient on her hands and knees trying to get babies to turn. Dr. Torres knows when I call, we've tried everything before we go for a C-section. We will get babies into different positions with all different kinds of tricks. She walked in on me showing one of the girls something I learned at a class called, from the Spinning Babies class, called Shaking the Apple Tree, where we literally put you on your hands and knees and we shake your bottom and we try to get that baby to turn into a better position.
And I remember, Robin, what are you doing? Because I haven't seen that ever before.
I'm known to play tug of war to get a baby that's stubborn and a mom that doesn't want to push. I've walked out of rooms and told the patient, I'm like, oh, you'll feel the urge to push. We're not giving up. And they appreciate it. You might not appreciate it in labor, but you appreciate it 6 weeks later when you're running around and not recovering from a C-section.
And when we're in the office and one of our mamas comes postpartum, believe me, the first one that's going to be hugging that baby and carrying that baby is Robin.
Absolutely. I tease them all that I'm off on Tuesdays and I'll babysit.
That's a wrap.